Welcome to this week's lecture. We'll be starting off with Native American clients and then we'll be moving into non-Western techniques, which are really interesting. So let's go ahead and get started. Your textbook gives some good examples of how American Indians have been treated in the past and continue to be treated in terms of some of that discrimination, stereotypes, that type of thing. And similar to what we've seen in other populations, when we think about how are they portrayed in the media, it's often either that they're barbarians or, that they're maybe victims, such as in the movie Killers of the Flower Moon. Her husband and uncle basically conspire together and kill off most of her family. In terms of this population, they have the highest national poverty rate at over 28%. And this is really interesting, if you want to go onto YouTube or, some other platform and find videos of what it's like living on the reservation, it's really sad because there's a lot of poverty that's going on there. And we saw this question in terms of who can qualify or what's the definition of being an American Indian. We saw this when we talked about the African American population in terms of the one drop rule. And so there's this similar idea of, what is the definition or who can qualify. And there are specific, resources or benefits of being considered or identifying as American Indian. There's free education, that kind of thing. But we want to be very careful in terms of this concept as well of, we've talked a lot about being careful not to put people into boxes this semester in terms of how others define who that person is. And so per Congress, at least, being considered American Indian is you have to have 25% of your blood has to be Indian. Some tribes have their own definition or their own criteria in terms of either like blood, like tribal enrollment or that blood quantum level. So some of this might also vary tribe by tribe. There's a lot of interesting and important information for this population in terms of the textbook. I don't think I've ever worked with someone who identified as American Indian, so I'll end up deferring to the textbook a lot because I don't have experience working with this population. So just some characteristics and information to cover. This ended in the 1960s, but apparently children were being taken out of homes and forced to go live in boarding schools, as we in America were basically trying to assimilate them, try and prevent them from being barbarians, basically, and so there was this idea that if we take them out of their home and send them off to a boarding school or send them off to live with basically European or white families, don't allow them to speak their native language. Apparently kids were being beaten if they were speaking their native language, which has then resulted in a lot of that language being lost. And if you think about it, the 60s was not that long ago. And so it wasn't until the Indian Child Welfare Act of 1978, which prohibited this practice. Again, this is really insane to me. Like, some of you guys are parents and have talked in discussion posts about being parents. So imagine that someone comes into your home and takes your child away because your child needs to be civilized. Like, that's just, crazy. The death rate is nearly 50% higher for this population compared to white individuals. Native American women reported higher levels of psychological concerns such as depression and anxiety. And this population is at higher risk, 2 to 2.5 times more likely to have substance abuse issues. This population, kind of similar to some other populations that we've talked about, tends to be more collectivist, so very community oriented, and might judge themselves in terms of whether their behaviors are going to benefit the tribe or not. The reservation is a place to conduct ceremonies and social events, which helps kind of maintain that cultural identity. And so, of course, if individuals maybe are raised on the reservation and then end up leaving for, say, economic reasons, trying to find a job or a job that pays better, they might feel that loss of personal identity or that loss of that social and family support if they're moving away from, the tribe or everyone that they know. In terms of the tribe, this is going to vary wildly depending on, there's a lot of different tribes, which means a lot of different cultures out there. So Family structure could be matriarchal or patriarchal, it just kind of depends. And kind of similar to some other populations that we've seen, extended families such as uncles, aunts, grandparents often help raise the child. So it's kind of that idea of it takes a village. For us as therapists, it will likely be helpful to identify the roles of different family members, so that interventions can involve family members or incorporate the appropriate family members, just to provide that additional support. And of course, depending on what tribe someone is from, a focus on sharing with each other may occur. So there may be this focus, again, kind of that collectivist side of things, of not spending energy or energy above what's required to accumulate wealth, but more focus on like, okay, well, I can pay my bills, so now I'm going to focus on the tribe or family or ceremonial rituals or family rituals or whatever that might be. There's this cultural piece of cooperation as well. So, kind of again, coming from that collectivist side of things, having this harmonious relationship is very important. So, either helping family members might take priority over going to school or work, cooperating within the tribe to make something happen, that type of thing. Culturally, time may be viewed very differently for this population. So, there might be more of a focus, again, kind of on prioritizing or focusing on living life here and now rather than planning for the future, or that aspect of delayed gratification. So some of us can look at something and say, for example, okay, it's going to take me 4 to 5 years to complete a degree, but I'm going to do it because I know it's going to be worth it. That valuing delayed gratification. Whereas this population may be focused more on like, well, what is life? Life today is happening. Let me focus on the here and now. Spirituality. So, similar to some other populations that we've seen, there's this huge focus on the spirit, the mind, the body, and this idea that everything is interconnected. So, that spirituality piece, if someone is, kind of very tribe focused or maybe was really strongly raised with a spiritual focus, is going to be really huge. Not only is there, there's harmony within, in terms of like family members of the tribe, but there's also this belief that harmony between mind, body, and spirit needs to occur. And so there's this belief or this idea that if things are kind of feeling off, or maybe if something abnormal is happening, maybe it's that the spiritual world and the physical world are like in misalignment. So if there's some kind of, like this misalignment, then this might result in either like a sweat lodge ritual or vision quest to ensure or bring those two different aspects back into harmony. And there is this strong belief in like the unseen world or the spiritual world. So not just, there's kind of these two aspects, our physical world and then whatever the spiritual or unseen world is. For us as therapists, it's important to know that body language may differ, so direct eye contact with an elder or someone in power may be viewed as disrespectful. So if you're working with someone, they may not make eye contact. So just paying attention to what that might look like or how that might play out in therapy. Many individuals may be caught between the expectations of family, parents, or caregivers, whoever raised them, to kind of maintain that traditional value or side of things, instead of kind of adapting more to the mainstream. So kind of this acculturation facet or kind of flavor, if you will. We've talked about acculturation with other populations, but it's acculturation slightly differently because this population has lived here, was born and raised here. But someone might kind of have a foot in each world, or how do they kind of balance, like, all right, the traditions of my culture or my tribe versus more kind of mainstream America, and whatever that might look like. So individuals might end up struggling to develop a positive self-image or strong ethnic identity. Again, kind of depending on, going back to the start of this slide, in terms of if someone was pulled from their family at a very young age and raised with someone else's family for several years, that could have ended up negatively impacting their self-identity. This population has the highest weekly alcohol consumption of any ethnic group. So I was watching a couple YouTube videos about living on the reservation, as I mentioned a few minutes ago, or housing on the reservation, and it seems like there's a lot of empty or abandoned houses or buildings, that have been turned into meth labs and that type of thing. During COVID, my husband actually went and worked on a reservation to help provide like medical care, and he was talking about just how poor the reservation is. Like, houses don't have running water, don't have electricity. If you don't have electricity, obviously you don't have internet, and so some of the level of poverty that individuals is living in is probably is very astounding once you kind of peel back the layer and look at what it looks like. Something that is specific to this population is paying attention to not only intergenerational violence, but intergenerational trauma. We'll talk about trauma in a research article here in a couple slides. But intergenerational violence is this pattern of, if you see your dad or your uncle or your grandpa or whoever being violent towards someone else, as a witness, it starts to become, you're continually being exposed to it, which then increases the likelihood that you might be violent in your own relationships. And so then the cycle just continues and kind of rolls downhill, if you will, unless someone is really like cognizant of trying to stop that cycle, which some people are able to break that cycle and treat their kids differently. But that is something to pay attention to in terms of, is violence or domestic violence occurring in the home, and how do we as therapists navigate that and support whoever the victim is. For suicide, individuals ages 15 through 34 years old, the suicide rate is about 250% higher than the general population. Many American Indians believe that mental health issues are a result of, again, that unbalance between the spiritual side of things and the physical side of things, or an unbalance in spiritual relationships. So again, that alcohol, the substances, the suicide are all factors that on the mental health side are likely often very prevalent in this population specifically. And so how do we as therapists, if someone is, say, maybe coming in for depression or anxiety, how do we make sure that we're being very thorough in our assessments to also assess for risk of alcohol? If someone is basically binge drinking every day, that can put them at increased risk for health concerns, for making impulsive decisions, such as making a suicide attempt. And so there's a lot of different kind of moving parts to be thinking about and paying attention to if you're working with this population specifically. So I talked about this a little bit in the last slide in terms of how reservations were hit particularly hard by COVID, as as I mentioned already. Homes, if they don't have running water, how are you washing your hands? Or if there's no internet, how are you staying up to date in terms of, it's several years post-COVID at this point, but how are you getting your information in terms of what you need to be doing to protect yourself, to stay safe, to make sure that you're doing those things like washing your hands or whatever things that the CDC might have been putting out at the time. And on top of that, this video, it's 3 or 4 minutes, so it's not very long. And again, it's 2024, so COVID is, not imminently happening like it was maybe in 2020. But this video talks about how a lot of elders ended up passing away during that time frame. And, it's this loss of information and knowledge that maybe hasn't been passed down or wasn't passed down. So that's something that the lady in the video talks about. So that's pretty interesting. And something to be considering as well, is there's this loss of information and knowledge in terms of maybe tribal rituals or language. How is that going to end up impacting the tribe moving forward? So some research. So I wanted to, this research article sounded really interesting in terms of kind of that historical trauma. So in 1988, the U.S. Bureau of Indian Affairs legally defined an American Indian as someone who was either enrolled or registered to a tribe or any person genealogically derived from American Indian ancestry with a blood quota of 1/4. I talked about that at the beginning in terms of like having 25% American Indian blood. Historical trauma, so that ties into this research article in terms of like who could be, like who was considered for a participant for this research article. Historical trauma is defined as an unresolved trauma resulting in grief that continues to impact the lives of survivors and subsequent generations. The perspective of elders were sought to more fully conceptualize the interrelationship of historical trauma with past and present generations as a basis for the creation of effective treatment approaches. It's important to consult people who have directly experienced the trauma to get basically that like firsthand experience of maybe what it was like to live through it, how they processed it, what resources they used, that kind of thing. The purpose of this study was to initiate dialogue about historical trauma among Native American elders because, as elders, they are acknowledged to be bearers of wisdom and are respected within the tribal community. And because they hold that historical memory for the tribe, their knowledge is a major something to be asking about, and it's really important in terms of our understanding, in terms of how to provide culturally competent and ethical services to this population or to Native communities. And that's something that's also really important to think about. Something that I didn't mention that's also specific to this population is there is this huge aspect of information being verbally handed down, right? So, in terms of stories, in terms of that type of thing. And so, paying attention to, again, if individuals are passing away, how is that information continuing to be passed on if, historically kind of things weren't written down? Understanding the perspective of the elders is crucial for development, as I talked about, in terms of that culturally sensitive treatment and specifically approaches to how do we address and how does this population process through that historical trauma. So research questions, one research question was what was their experience and their understanding of historical trauma? How is historical trauma affecting their families and communities today, presently? And what recommendations do the elders have about how to help individuals heal or process through historical trauma? So this was a phenomenological research, which again is more those kinds of interviews as opposed to numbers. So the phenomenological research seeks to understand how individuals make sense of a particular shared experience. Inclusion criteria, so as I already mentioned, the individuals had to self-identify as having a Native American ancestry, and they must be considered by their elders as being part of the nation or part of the community. So, someone couldn't just walk up to the researcher and say like, hey, I want to participate. Like, no, the elder has to say like, yes, this person is part of our community, or yes, we do consider them Native American. They must have lived, they must either have currently been living or have lived most of their lives in a tribal community to ensure that they had that significant experience or history with the historical trauma. So in terms of data, individuals were interviewed and the interviews ranged from 45 minutes to 3 hours. They also did focus groups, and researchers wrote reflective memos about the reactions to the research process. So it's kind of two-sided here. And the results there's 3 different themes that were identified for the results. The first one was understanding historical trauma. So this is looking at historical traumatic events, the impact in terms of the boarding schools that we talked about, and then internalization of that oppression. And then theme 2 is the current impact of historical trauma. So this is looking at basically the side effects of that, such as the alcohol and substance abuse, the loss of culture and language, community discord as symptoms of historical trauma, and then negative effects of technology. And then also looking at recommendations for healing, so focusing on the positive, increasing awareness and education, and a return to the cultural and spiritual ways of life, and focusing on educating individuals in terms of language learning so that language isn't lost or doesn't continue to be lost. Impact and implications, so again focusing on the positive, so considering a resilience counter narrative that promotes the strengths and positive qualities of American Indians. Another option may be helping clients deal with internalized oppression, so how do we help our clients process through that? And then helping clients examine their own thoughts, beliefs, values, and emotions, and identifying which are the results of being socialized in a country that projects negative images of American Indians. So helping our clients process through that, and how do they explore that probably internalized view of themselves, but also change that self-image, as I talked about earlier, from something that might be very negative. I've had clients say, like, I hate myself, or I hate who I am. So how do we change that to be more positive and to say, all right, get to a point where I do love myself, I love who I am, or I at least love the direction I'm going in life. Limitations, I didn't see any limitations for this study. Maybe it wasn't, maybe they just didn't write it up or didn't address it in the research article. And then future research. So interestingly enough, this article is a little dated at this point. It's 2015 when they did their research. But at the time, there was no other research that had been done in this area. And so it can, future research would at that point in time have been continuing to focus on tribal members re-engaging in their native language, so exploring what that looks like, exploring maybe returning to tribal traditions and ceremonies, and does that have any impact in terms of this historical trauma. And so there's several kind of different future research articles, kind of future directions that research could have taken in from 2015. Again, this is a little dated at this point. But I found it really interesting because historical trauma, kind of that intergenerational that I discussed earlier, it does kind of continue to go if there's no, if someone doesn't have enough awareness to say, hey, this is occurring. How do I process through this so that it doesn't continue, basically so I don't pass it on to my kids or my grandkids, etc. So yeah, interesting research article here. And here are my references, or reference. All right, so now we're going to switch gears and talk about non-Western medicines. And I also really like this content, so let's go ahead and get started. So this chapter starts off by providing 3 different examples of individuals, one from Nigeria, from Laos, and Navajo Nation, and how each of them were getting Western therapy approaches. They were working with a therapist, but that approach wasn't helpful. And so eventually they sought, more indigenous remedies and were able to get their concerns addressed. From a Western standpoint, we have evidence-based medicine and evidence-based practices. And so sometimes it can be individuals who are very kind of westernized can view alternative healing approaches as maybe unscientific or supernatural, or like, oh, that, seems like, is that really going to work? I don't know. I question it. But it's important to, again, refocus on who our clients are and what is going to be most helpful for them. So indigenous healing, this is a helping belief and practices that originate from within a culture or society. And it's important to, again, just keep our clients in the forefront and ask what might be helpful for the client. And to us, it might be, depending again on where you were raised or how you were raised, or, if you're very kind of ingrained in the Western mindset, it might be like, oh, that seems questionable. I don't know that, like, is that really going to work? But if our clients believe it's going to work, then it's definitely worth trying and keeping them in the forefront. It's also really important not to, make assumptions, over pathologize, misunderstand, or misinterpret. And so over pathologizing, this is overestimating the degree of pathology. So, the textbook, going back to one of the examples, Joy from the Navajo Nation, she missed her aunt's funeral, circumstantial, unfortunate events. She started having nightmares. She was losing weight. She wasn't sleeping well. She was having a lot of anxiety and worrying about death. And the therapist, therapy wasn't helpful. And so eventually her mom, believed that she was experiencing what Navajo would call ghost sickness. And from a Western, if we were just purely looking at this from a Western approach, we might have diagnosed anxiety or maybe PTSD or major depression. We don't know the textbook example. There's not enough information about her symptoms to really be able to diagnose one or the other. But as a therapist, that's probably something along the lines that we would be thinking. Her mother suggested that she come back to the community. And so Joy did decide to go back to the tribe and seek help from the tribal spiritual leader. She completed a sacred ritual so that her aunt's spirit could find peace. And it sounds like, based on kind of what the textbook is saying, that her symptoms then resolved or decreased or went away. And so if from a Western standpoint, if we diagnosed her, that would have been an error. And so at the same time, it's kind of this balance of how do we not overestimate issues, or how do we make sure that we're not over pathologizing or misdiagnosing individuals, but at the same time, we also need to be careful in terms of not underestimating the severity or complexity of someone's emotional condition, because that could also be an issue if we're underestimating or saying like, oh, you're fine, it's really not that big of a deal. We need to make sure that we're taking both approaches or both sides of things very seriously and kind of balancing, and really asking a lot of clarifying questions to make sure that we're trying our best to understand what's really going on, so that we're not doing one or the other, overestimating or over pathologizing or underestimating. So there's several different indigenous healing options, and so I'll talk about a couple of these here. So there's that holistic approach. I've kind of already talked about how there's this interrelatedness or balance. There's the spiritual side, but there's also the physical side. So approaches along this line might be herbal teas or medicines, or kind of more that natural holistic approach to things, focusing on maybe curing the physical ailments, which kind of gets into that metaphysical side of things, such as yoga, meditation, massages, even, to really, again, kind of balance out the connection between mind and body. Then there's the spiritual side. So, for example, Puerto Ricans believe in spiritismo. So the idea that spirits can have a major impact on people residing in the physical world. For Chinese, this might be working with chakras and spiritual energies. And for some Hispanic populations or cultures, after someone dies, there might be this belief or idea that, I can see my grandpa's spirit, or I can talk to my grandma's spirit, or she's still here with me. And so again, not over pathologizing that, because from a Western standpoint, we would say something like, you shouldn't be seeing or hearing things no one else can see or hear. That's really concerning. You're hallucinating or that type of thing. Whereas for some populations, again, depending on what the person's background is, that might be very normal, or that might be even sought after or kind of looked for, of like, oh no, it's okay, my grandma's spirit is still here with me, or she's still looking out for me, or something like that. So exploring whatever that is, Chinese chakras, balancing that energy, or identifying what the spiritual energies are, and if they're maybe off, how do you rebalance them, etc. And for us as therapists, it's important to be open to working with whoever that individual spiritual leader is, whether that's a shaman, or with Jewish clients, a rabbi, or with Islam clients, the imam, or whoever it is, to again provide a holistic approach and a team-based approach to help our clients get through whatever they're facing. I'll talk about I'm never sure if I'm pronouncing this right, the Ho'oponopono. Anyways, I'll talk about that here in the next slide. And then for Morrnah therapy, I'll come back to sweat lodges here in a minute. For Morrnah therapy, this is a Japanese psychotherapy which moves patients towards a position of accepting and living in harmony with nature, including emotional fluctuations. So basically trying to be more authentic through a process of rest and action taking, being more authentic to our human nature, but also recognizing that we're going to experience, it's part of human nature to experience a range of emotions. So not focusing on like, I only want to have positive emotions, or I only want to be happy, but recognizing there's going to be depression, there's going to be sadness, there's going to be happiness, there's going to be peace. And so how do we basically just accept all the emotions and explore or kind of be comfortable with those emotions, as opposed to trying to avoid a certain emotion set, such as depression or anxiety. In terms of the sweat lodge, so kind of coming back to Native American population, this is one of those ceremonies where on the spiritual side, again, just kind of processing through things, and incorporating that if that's something that is important for the client. I do want to highlight that it's, there's a lot of different options here on the slide. And so it's depending on what populations you're working with, and especially if you're working with maybe in a very diverse city like Chicago or New York, you might end up working with a range of different clients. And so it's important to know or remind ourselves that we're not going to know everything. It's important to just work with whoever your client is and build a relationship with them, build rapport with them, and ask them, get a sense of knowing them and working with them, build that relationship, and then say, what's important for you, or what do you want to work on, or what do you want to incorporate into therapy. And it's just better to ask instead of making assumptions, especially given that you're not the expert in this client or this population unless you're literally from there, right? So places like Chicago, New York, again, there's a plethora of different populations. And so how do we, I want to highlight that it's important for us as therapists to also not become overwhelmed with like, I have to know everything, or I have to be the expert on this population. Like, no, just be human, be the best therapist you can be, and go from there, and just be really open, and ask a lot of clarifying questions instead of making assumptions. So I included a video here. It's not too long. And so Ho'oponopono, it's a prayer of forgiveness. So the word roughly translates to cause things to move back to balance or to make things right. It's very Zen concept, actually. So accordingly, you chant this prayer over and over, and it's a powerful way of basically like cleansing the body of guilt, of shame, of haunting memories, of ill will, of bad feelings that keep the mind fixated on this, on these negative thoughts that many of us end up having. And it's also kind of this forgiveness practice. So it, can kind of refocus that inner monologue that many of us have. And so it's this idea of like, I'm sorry, please forgive me, thank you, I love you. So again, it's moving from this kind of very negative focus to how do we rebalance or change those inner thoughts that we might be having. So check out the video. I'll put the link in the description. Naikin therapy. So there's 3 questions with Naikin therapy. And you can respond to it maybe once a day, write down the answers to these 3 questions. And so you can see the questions there on the screen. Number 1 is whatever I received today. So for example, my husband brought me some coffee this morning, or he made me a grilled cheese sandwich last night for dinner. Or what have I given today? For example, I fed the dog and took her for a walk, or I folded the laundry and put my husband's laundry away. What troubles or difficulties have I caused for others today? For example, if if I snapped at a customer, someone on the phone, or if I didn't call my mom like I said I would. And so you would write all those things down. And it's the idea behind this is that, to remind ourselves that we're connected with the world around us, and to expand our awareness of how much we receive from others and how much others kind of give or pour into us. And then to remind us to be more grateful about what others are doing for us, and to be grateful for that connection that we have. And so it's structured to, again, help us investigate and remind ourselves of those relationships, increase that awareness, kind of take a closer look, as opposed to just kind of mindlessly going through our day. So I like this, and I'm going to make this an exercise that is one of the discussion post prompts or questions that you can respond to. I like it because it's really simple. It's not like overly complex. It probably takes 5 to 10 minutes if you wanted to do it every day. So this would be a fun exercise to incorporate. Morrnah therapy. This is a simple Japanese technique to rule over your emotions. I kind of talked about it a little bit in a couple slides ago, but it's, again, exploring that coexisting with unpleasant feelings and focusing on like, well, where is our attention at, right? Because especially for our clients, if they're experiencing a lot of, say, depression or anxiety, it can become really easy to kind of focus in on whatever those negative emotions are, and what we focus on grows, right? And so if we're focusing on anxiety, that anxiety becomes bigger and bigger and bigger. So then how do we pay attention or increase our focus on kind of rebalancing those things back to well, I'm experiencing both positive and negative emotions, not only negative emotions or not only anxiety. Um, a piece of this is that self-reflection of kind of taking a step back and looking at the bigger picture and saying, all right, well, what are all the emotions that I'm experiencing, instead of zoning our attention in on just the negative. And then a piece of this therapy approach is acceptance. So, acceptance of those internal emotions, or internal experiences, thoughts, or emotions that we might be having. And then also acceptance of external circumstances. So, reminding ourselves that there's only so much that we can control, or refocusing on what can we control and what's outside of our control. So acceptance of the external, acceptance of other people, acceptance of our past. So acknowledging, like, I can't go back and change my past, but I can change who I am or where I'm going in the future. So I like this approach as well, because it's also not super complex. It's kind of very, like along the lines of rebalancing or balancing things out, changing the focus of where our attention is, that self reflection piece. So I like this therapy approach as well. So here are discussion posts for this week. You've got a couple different options. I'm trying to change it up a little bit and give you guys 2 or 3 different options to pick from, as opposed to just, all right, here are the 2 prompts. So enjoy.